Dear colleagues, ladies and gentlemen, so I'm going to talk today about should we invest in pocket-sized ultrasound device in this session about acute heart failure. So these are the two devices that are available in the market today. And the main advantage, as you all know, about this portable device, that they are low cost, they are very portable, they are easy to use, and mainly they can be used on battery, which is very, very nice, and in the pocket, of course. So in patients with acute dyspnea, first of all, we all do the clinical evaluation, and of course, the diagnostic of heart failure is a clinical diagnostic. Most of the time, we'll do a NT-proBNP, and I've reminded you about the confounders of this technique with a very high negative predictive value. And clearly, all patients with acute heart failure must have a full echo study. The only indication for portable system and pocket-sized ultrasound device is when a full echo study is not immediately available. For example, in A&E department, in medical departments, in places, this is highly dependent on your local setting. If you work in ITU and you have a proper echo machine which is 5 yards away, of course you are going to move it at bedside and do a full assessment. But sometimes you do not have this luxury, and then a portable system may have its full use. So it's going to enable rapid detection of left ventricular systolic function and also rapid detection of volume status. And in all studies, and including into our own experience as well, the duration of the study is less than 5 minutes. So rapid detection of left ventricular systolic dysfunction is, as you can see, the values of sensitivity, specificity by internists and intensivists after a short duration of training. We can also assess the volume status by the IVC diameter with its respiratory variations. You can see one of the algorithms that has been offered in the literature. As a rule of thumb, what we use is that when you have a large IVC diameter, the right atrial pressure is high, 15. So this is just a shortcut. So pocket-sized ultrasound devices are useful when a full echo study is not available immediately, when you have clear left ventricular systolic dysfunction, because you can do an immediate treatment. This improves patient flow and, of course, cost reduction. When you have an ejection fraction, which is 50% or more, you have to look for other features. And you know that this portable system do not have spectral Doppler, for example. And also, the color flow mapping is limited and is not the same as on a full machine. However, you can assess left ventricular hypertrophy, you can detect pericardial effusion and tamponade, you can detect pleural effusion and left atrial dilatation as well. And all this is very easy. This is an example. The cardiologists usually do not tend to look at the pleura, but it's extremely easy to do on both sides. And the main parameter is the distance between the diaphragm and visceral pleura. And this distance has been shown to be correlated with the amount of pleural effusion. Susanna spoke briefly about that, but I would like to insist on the fact that we are here with transthoracic echo and a portable device. And it's quite well known that we can have very negative transthoracic echo in patients with acute heart failure and severe mitral regurgitation, just because color flow doesn't work in this situation of low cardiac output. And if you have the slightest doubt about the origin of the dysfunction, please feel free to do a TOE, especially if the patient is under mechanical ventilation. And this is a very well-known false negative of transthoracic echo in this situation. So basically, we should say from now on that, of course, let's buy one. However, it will only be justified if this small device have proven feasibility, agreement with conventional system in the assessment of the main parameter, and of course, high accuracy in the hands of experienced staff, and valuable tools for non-experts. And of course, it raises the problem of the duration of the training and the learning curve. So let's look at this different aspect. The feasibility has been shown in several studies to be quite good. especially assessment of the left ventricle, pericardium and pleura, which, as you can see, reach 100% of feasibility, and this is by junior doctors who are not expert in echocardiography. The agreement between this portable system and conventional system is quite good in the hands of experienced users, of course, cardiologists, and anyone experienced in echocardiography. They allow a focused cardiac assessment. As you can see, as you know, only a limited number of parameters can reliably be assessed, and you can see the correlation on this diagram, and there are now several studies who demonstrated that in the hands of the expert, the accuracy is quite high. This is the same demonstration for the Siemens device with excellent correlation as well. However, not everybody is an expert. And there is clearly a lower sensitivity and a lower specificity when these very small devices are used by people who have very limited experience in echocardiography. And especially this example from the Hammersmith, when the students and junior doctors had only 2 hours of training. 2 hours of training for people who were completely new to echocardiography. And you can see the additional information brought by this quick assessment in terms of diagnosis accuracy and also detection of left ventricular systolic dysfunction, both sensitivity and specificity. And you can see the values on your screen, and they are quite impressive, taking into account that it's only a 2-hour tutorial. There have been a few interesting options for improving the training, especially in remote area. And this is an example of an iPhone using FaceTime, looking at the screen and transmitting online with a wireless router. And so the operator was supervised online by an experienced user in a completely remote location. So I thought it was quite nice to show that. There are also a lot of studies coming out about intensive care unit and emergency room, and all these studies show that it's quite useful and quite good. I would like to raise caution here, because I believe, and this is my personal opinion, that these units must have or should have full equipment and trained personnel, because this is the most difficult situation, both clinically and for imaging. And it's very easy to miss important diagnostic with these very small portable devices. And I would really recommend that intensive care unit and emergency room have a full equipment, full-size equipment and trained personnel to really deal at best with these very severe patients. Indeed, this portable system have limitations. The expertise is required, and we all know that echo is operator dependent. They have a lack. They do not have spectral Doppler. They have a small screen, however high resolution, and the color flow mapping is limited. They allow us to perform only focus studies, and we have still a lack of outcome data with very small number of patients included into the studies so far. And this is an example of a patient where the right ventricle is really very small and compressed by a large effusion, and here the diagnostic was missed. So again, experience, training is a key. So in terms of key messages, pocket-sized devices do not replace full echo studies. They are complementary to the physical examination. It's very important to focus on image quality, and image quality must be the main focus for all imaging doctors. These devices have pitfalls and limitations. We need to perform evaluation and quality control, and these images should be downloaded into a hospital shared drive for review by an expert in imaging. There's no way we are going to do these studies in 2 seconds and nobody will have any trace of them, because otherwise nobody will learn anything. So in summary, these devices are useful. especially when a full echo study is not available immediately, to reduce the delay to diagnosis and treatment, to improve patient flow, and for cost reduction as well. And of course, because it was a session of acute heart failure, I did not show the role of this device in conventional medicine ward or for screening, but they also have a very important role for cost reduction. Thank you very much.